Today's video is all about how to study pharmacology in nursing school. If you're interested in this, then keep on watching. Hi guys, welcome back to my channel. My name is Valery Nunez and I'm a BSN student currently in my second year of nursing school. I make videos all about nursing school to help pre-nursing and nursing students succeed. If you're interested in this, then click the subscribe button and also click the notification bell so you can be notified every time I upload a new video. So in today's video, I'm going to show you how you can study for pharmacology in nursing school. I'm going to show you what I personally did, and I just want to make a disclaimer really quickly that this is not going to work for everybody. Everybody has a different study method and they learn differently, so just putting that out there. I'm just telling you what I personally did, and I think that it may be beneficial to some of you. Also, this is going to vary by nursing program, because some nursing programs have specific things that you need to know, about medications and stuff like that. So I'm going to show you what my program required for us to know. Okay guys, so I'm going to show you everything that I used to study for that class, all of the resources that I used, the things that I didn't use, and what helped me the most. This is the book that was required for my pharmacology class. We also had a study guide. I did not read the book. I did the study guide though, because we were given assignments from the study guide, but I did not read the book. Like I said before, I do not read books. It is very time consuming, and also it is a very passive way of learning. You do not retain the information you're reading. Some people can, some people have that God-given talent, but I can't. It's not for me. Also, I personally didn't like the way my professor did the PowerPoints. I feel like I didn't really learn anything. So what I did, it was that I used nursing.com. I'm going to put a clip of it right here. I mentioned this in my last video. I am going to be mentioning similar study resources that I use, because they genuinely helped me when I was struggling in that class, because to be honest, I struggled a lot, because like I said, I did not understand when I was in my lecture book, because it was just too much. So I did use nursing.com for that. If you don't know what that is, it's basically a website, basically like a nursing academy or something like that, that they have short lectures from a lot of topics for nursing school, and they do have a whole pharmacology course, and it's incredible. That's what I used, and it helped me a lot. Also, they have a bunch of questions. Practice questions are really important, guys. Also, another resource that I have talked about before is Pygmonic. I'm going to put a clip right here of how it looks. This also helped me a lot for my pharmacology class, and it just helped me memorize the drugs easier. I am a very visual person, and also I need to repeat the information over and over again for it to stick on my brain. So basically everything that I'm going to show you, it's something that is for visual learner and spaced repetition stuff. Okay, so basically what was required of us for each drug classification that we were talking about, for example, antihypertensive drugs, we needed to do an active learning template. So this is what it looked like. I don't know if you can see it. If you I'll put a picture of it right here. So we needed to do this for every class of drugs that we were learning. So we will basically need to know the expected pharmacological action, the therapeutic use, the complications, the medication administration, contraindications, interactions, nursing interventions, and the client education. So this is what our program wanted us to know specifically, but this varies by program, to be honest, because I've seen videos like this that they add some stuff that they needed to know, or they don't have the exact thing that we needed to know. So it varies by your program. So to make these medication sheets, I used the Davis Drug Guide app. I have mentioned on a video before that this is what I use instead of a regular like medication like drug guide, because the one that my school provided for us, I did not like it. I could barely find some of the medications that they wanted us to know. So this is why I invested in the Davis Drug Guide app. It is actually a $40 a year subscription, so I feel like it's a good investment. Also, somebody told me that if you like Google the medication name and then write Davis Drug Guide after that, then the actual medication will pop up with like everything you need to know about it from like the Davis Drug Guide. So I didn't know that, but I still have the app because I pay for it already. So also, I wanted to talk about a specific book. Like I said, I do not read books. I read them very rarely. If it's something that the professor said, like, oh, it's in this page, you have to read it, it's going to be on the test, or if I need like more clarification and something that I had a hard time like grasping the concept, then I will read a book. So this book, actually, I won it on a giveaway on Instagram, and I already had taken my pharmacology class, but I feel like this book is really good for those that do like to read the book. And because it's just like, it's like condensed information. I know it looks like pretty big, but it's not that big as opposed to some other like pharmacology books that I have seen. And like when I was like looking through it, the information, I feel like it's more concise and just not that much. It basically says the key topics. So this is everything you will need to know for like your NCLEX exam. So this is great for those that do like reading the books. Also, I wanted to show you this. This is my nursing flashcards. These are from Level Up RN. I put it in an advanced box. So I actually did a video from like reviewing this. It's gonna be like right here, I think. So if you want to go watch it, but when I was in my pharmacology class, I did not have these cards, but I wish I did. I'm going to show you really quickly why. It will save you so much time, because like I said, like you need to know certain things about a medication, and flashcards is the best way to learn them. Well, in my case, I feel like that's the best way to learn it. And if you like get these cards, it's going to save you so much time. I know that some people really like to write their own cards, but in my opinion, like me personally, it took so long that like I barely had time to learn them because I did so many flashcards. But this has the most important information that you have to know for your test and for the NCLEX too. So I'm going to show you really quickly how a card looks like. So this first deck that I have here is called the Pharmacology Basics one. I'm going to like do like a close-up, or if not, you can go watch the video that I like went through all of it. This basically is the basics. So you got like prescriptions, pharmacokinetics, routes of administration, IV complications, and blood transfusions. So these are like the basics you need to know for pharmacology. So let me show you one. Pharmacokinetics, metabolism. So you can see right here how the card looks like, and also in the back it tells you the most important things that you have to know. So like I said, I did a very in-depth video of this, so if you guys will want to watch it, it's going to be right here, or I will leave a link in the description down below. So this is the next one, the next deck that I think is very important if you want to get it. So these are the pharmacology flashcards. They are by system. So we got respiratory, cardiovascular, nervous, and so on and so forth. So these are great flashcards. So the first one is respiratory. I'm going to show you really quickly how it looks like. Like I said, I'm going to put a video right here, like a close-up, so you can see. So this is respiratory. This is the beta-2 adrenergic agents. And in the back, you have the indications, the mode of action, and the side effects. And also, they put like a little hint right here in the bottom. And also, you have like the common drug names. You have it in generic name and also in the trade name. So these are great flashcards. It's not like too much information that you that you don't need to know. It's the information that you certainly have to know for each medication class. Okay guys, so I also use Pygmonic a lot, and I actually mentioned this on my last video, so if you want to go watch that, because I showed basically an example of how to use it. I'm also going to put a picture right here of what it looks like, but it really helps me. This is one of the websites and apps, because they have an app too that helps me so much. Like, they literally have everything that you could possibly think of that you need to know for nursing school. So if you want to try this out, you can click the link in my description to give you 20% off of your subscription. So going back to the flashcards, this is something that I think everyone should do, either if you write them on your own, or if you get the Level Up RN flashcards, or if you use like digital flashcard system like Quizlet or Anki. I use Anki too, and I love it so much. It's a little confusing at first, but if you look for YouTube videos, there are a lot of YouTube videos that have tutorials on how to use them, so you can like get the best of it. So flashcards are really important, and more with medication. Flashcard, it's like easier to learn them. And when you're making flashcards, do not make a flashcard for each individual drug. You should be doing them by drug classification. For example, antihypertensive, and let's say drugs for diabetics, and also for Parkinson's disease. So in my opinion, and personally for me, I love the Level Up RN flashcards because they're by body system, cardiovascular, respiratory, and within that they are like antihypertensive, within like the cardiovasculars and things like that, like beta blockers. So it's like they are classified, and it's easier for you to learn them. So I really recommend this. And if you are doing your own flashcards, make sure that you don't do a flashcard for each drug, and put the information that your professor in your nursing program wants you to know. This is why I said at the beginning, this is basically what I did to study for that class and to get a good grade on it. But everyone is different. I hope I can help some people that are like visual learners like me, and that don't read the books like me. So yeah. And the last thing that I wanted to tell you guys is to do a lot of practice questions, so you can get used to seeing them for your test and also for the NCLEX. So I have showed in videos before the book that I used to make practice questions, and also nursing.com has practice questions. That's the website that I use, and also Pygmonic has practice questions. And those questions, I put them on Anki, and it's like they use spaced repetition. So if I talked about this in my last video, so I don't want to like go through it again. So you can go watch my last video right here. But yeah, also the book that I use for practice questions, I'm going to put it right here, a picture of it. It's the NCLEX review book. This is the latest edition. I think they're coming out with another one, but this is the one I have right now, and it has a lot of practice questions. So, and this has helped me a lot learning how to answer like the questions. Also, if your program uses ATI, my program does, they have like modules or something like that. They basically like courses, and they like teach you about the medications, and also they have a lot of practice questions. They have tests that you can take and quizzes like after you finish like with the module. So yeah guys, so that's it for today's video. Thank you so much for watching. I hope you learned something that you can implement in your study routine, and it can help you pass your pharmacology class. If you enjoyed the video, please give it a thumbs up, and also subscribe to my channel down below, and don't forget to click the notification bell so you can keep watching the videos of my study series. Thank you guys. Bye.